I'm Tom Donahue with Brock Community Action. Thank you for tuning in to this important broadcast right from the front, the Rutland Regional Medical Center, with some very important information for the greater Rutland region and beyond. We thank you very much for being part of this update. It's very important that you hear from the leaders locally. I want to thank PEGTV, of course, and all Catamount radio stations for broadcasting this out to all of you as we make our way through days and days of this pandemic and how we're addressing it right here on the local level. To address that for us today, two of our area leaders from the Rutland Regional Medical Center, the CEO and President, Claudio Fort, is with us. Claudio, thank you for being here today. We really appreciate this.
Thanks for having me back, Tom.
And Tom Rounds is here. Tom is the RN and Director of the Emergency Department at Rutland Regional Medical, and he is Operations Section Chief for Incident Command. So we're going to move right into the questions. And what a lot of people have on their minds, we'll sort of start with a big question with lots of layers, I think, Tom.
Sure.
And so feel free to take your time going through that.
Yes, sir.
But a lot of what's on people's minds right now is, what is the hospital's plan when we start seeing a large influx of patients?
Yes, well, thank you, Tom. We really appreciate it, and appreciate PEGTV and Catamount Radio having us here today. We have stood up our incident command in the hospital, and as the pandemic rolled out, we're actually on our 30th day of incident command for the hospital. Hospital incident command is made up of about 26 core staff who meet twice a day, and every morning and every afternoon we go over our planning, logistics, operations, and finance, and look at all the aspects of this pandemic and what we need to do to plan. And then every hour in between that during the day is filled with activity that we're really working on the objectives that we have to get ready as the surge increases. We are operating off of a surge plan, so that's really the key driver of what we have to move along those levels.
Excellent. I did want to ask Claudio Fort about the telehealth options that are available for patients. I'm hearing a lot about that, and I think that's a fairly significant thing right now in the way that you're trying to process regular health care, along with the incidence of people concerned that they might have COVID-19.
Yeah. No, we've ramped up our telehealth services very quickly, and they're going remarkably well. So if you are a patient at one of the RRMC specialty clinics, you'll find that your providers are reviewing your medical records, and they're determining whether your visit would be conducive to a telehealth visit. And so for everybody that we can, we're going to do these visits remotely via telehealth. And so there's three ways you'll have your visit. One is you'll do it on a smartphone or a tablet or your computer via like a readily available application, and you will be able to visually connect with your provider and have that visit. For another group, it's possible that you'll be asked just to have a telephone call visit. That might be the simplest and easiest and best way to conduct your office visit. And then there's a group of patients that you actually will have to come into the office, and we'll take certain safeguards to make sure you're safe and we protect the office staff. And that's not just going on for the hospital-based clinics. I think all of our primary care providers and all our partners in the community are doing the same thing. So the community health series of clinics in Rutland and Castleton and Brandon throughout the area, the Hogan camps, Dr. Stickney, and I think many others or most others are providing these type of telehealth visit options to include mental health counseling. If you're having issues like anxiety or depression, you can have those visits very effectively over telemedicine.
And along those same lines, Tom Rounds, regarding the alternative care sites, how are we using them internally? And then a second part of that question I wanted to ask was, going forward, will we have to look outside the hospital if we exceed our capacity?
Sure. So the surge plan that we have in place has been developed with a lot of thought and a lot of input from our physicians and our nursing staff and leaders throughout the organization. As we've entered into the first level of surge, we've taken some units within the hospital and we've converted them for specific care. So our endoscopy unit We stopped doing endoscopies that were not emergent, and we converted that unit to a negative pressure. And right now it's an area to take care of really 10 critical care patients within a negative pressure area. And staff have been really stood up to train and to be able to adapt to those areas to be able to staff it. So we have a labor pool that's a group of folks that have been pulled together, cross-training in different areas. We have people coming in from the community that, an example is Castleton nursing students. In their senior year, there's some of them that are going to be trained, and with the state's assistance on licensure will be licensed nursing assistants, so they're giving us support. In addition to that, we've taken half of a unit, or actually a quarter of a unit, up on the 5th floor, and that's been converted 5 West into a negative pressure area. And if you can imagine, our facilities folks are going through the organization. They're putting up temporary walls. They're converting and putting in and taking out windows to be able to facilitate the negative pressure, and really have stood up and answered the call for us. So we're very proud of our staff, very proud of our community partners and support we're getting.
And since I'm a real neophyte, can you explain negative pressure?
Sure. Basically, the pressure in the air through a machine that we use will draw down the pressure in that space and exhaust it out of the building, so that anything that's airborne in that area will be able to be exhausted out. And that helps to protect the other patients that are there and also the staff. Now, the staff does have to wear personal protective equipment in those areas, and that helps protect them from particulates that they might be inhaled if they're in very close proximity.
Excellent. That's incredibly interesting. And a person like myself would not have known that, but I love that type of information. I think the public appreciates that.
Yes, and
Thank
the
you.
second part of your question I just wanted to answer is that as we go through these surge levels, we'll exercise through the hospital and continue to open up additional spaces to care for patients. And we have all the plans in place and the staffing models that'll get us to that point. And once we exceed the capacity of the hospital, then we're looking for an alternate care site outside of the hospital. And that planning and development is underway for a site within Rutland County.
So you mentioned, and I want to ask Claudio, because Tom, you mentioned about the personal protective equipment, the PPE.
Yes.
And people are hearing a lot of these days. And Claudio, I know that the community has stepped up in terms of support regarding making masks, and you even put the star up on the Rutland Regional Medical Center, which we often see it during the holidays, and it was nice to see in the sky again above Rutland. So I didn't know if you could maybe talk about that and other donations that you're seeing that make a difference in your staff's lives every day.
Yeah, it's been really, really touching for myself and the other staff at the hospital. We've had some of our local contractors call us up and say, hey, I'm local painting contractor, large local businesses in the area, call us up and say, hey, we've got some of these N95 type masks that we've used in our business, but we'll get them to you if you need them. And we have needed them, and it's been great. And this will actually save lives. And it's been very humbling and incredible that people will take stuff that they need and use in their business and willingly donate them to the hospital. I think the star thing has been really incredible. Just about a week ago, one of our longtime legendary maintenance facilities people, Howie Stratton, sent me an email, said, hey, Claudio, we should put the star up. And our facilities guys, as busy as they were right on it. And that night, the star was up.
And can I just say the community really noticed that right away. I got to tell you, it was maybe even more of a statement than you realized it would be for folks that, and it stands so high in the sky and, just powerful. Well,
I didn't realize it, but I think we're fortunate we have people like Howie who realized and could see how important that has been for our community. And, I think Nancy Greenwood, local resident, put this on Facebook and started a site called Help Vermont Light Up the World. As of today, we have 17,000 people following that, and she's gotten, and we have gotten, support from other hospitals throughout the country that have lit up their hospitals similarly, and also around the world. It's been an incredible support for us, especially here at Rutland Regional and here in the Rutland County, and it's been a great sign of hope and solidarity throughout our country and the world. So there have been some amazing things, and then the community has been stepping up. Our own Tracy Moore is leading some of that to accept donations and so forth. People have been making masks. They've been donating funds to really do whatever they can to help. So it's been really gratifying and really, really humbling, to be honest with you, Tom.
With your supplies and then the donations and from the community, where are you now with personal protection equipment as far as your comfort level with?
Yeah. That's been a big question and a big concern, as you can see across the country. We are okay right now. The problem is we don't know how big the spike is going to be and how long this duration is going to be. So what we have done at Rutland is we've put in place some conservation measures. And these are changing rapidly. The National Center for Disease Control has changed their recommendations for this to allow us to safely reuse some of these masks and to preserve some of them on how we're using them and which patients we're using them on. What we want to make sure is that we do not run out of this critical PPE when in 3 or 4 weeks, when we project to be at the top of the curve and we have a high number of infectious and very sick people. That is when our staff are going to need the most, and we've got an incredible team of people who have researched this and have come up with the best plans to protect our staff, our patients, and make sure that we have this so we can continue operating the hospital for the community.
Thank you. That's very reassuring, and we have all your staff in our minds every day, in our prayers as well, and we thank you for that protection that you've been able to provide.
Thank you, Tom.
At this juncture. Tom, speaking of that, and Tom Rollins, I want to repeat, is the director also of the Emergency Department at Rutland Regional Medical Center, in addition to being Operations Section Chief for the Incident Command. And I wanted to ask Tom what additional measures, safety measures you're putting in place when screening patients. So we'll turn this to the patient for a moment.
Sure.
Talk about that.
What we've done is we've limited access to the hospital, so we've closed down a lot of our entrances, and as people arrive, whether it's a visitor or a patient, we're screening them for kind of the positive signs. We're really looking at fever, cough, and shortness of breath. There are some other indicators, but those are the top drivers that really would put other patients and staff at risk, and so we apply a mask as soon as those people arrive and ask them to wear a mask as we start the evaluation, and then the staff would don the appropriate PPE to go along with that. A couple of things we did in addition to that is they arrive at the emergency department on Monday, because we've based it on our expected volume. We have a tent outside. The tent will begin to screen patients there on a split flow. We've opened up our ambulance bay, and with the support of our facilities, again, and some local contractors, we've taken the ambulance bay and closed it down and turned it into a respiratory evaluation unit. And this respiratory evaluation unit will be staffed by nurses and physician assistants, and we have the ability to do chest x-rays there, screen patients, provide care, and some of those patients may be able to be treated and released right from there without ever having to come into the core of the emergency department. Patients who don't have the COVID kind of symptoms or that are maybe for an injury of some kind, we have an agreement with our orthopedic center, so we can see them initially in the ED, check them in and make sure that they're stable, and then our Vermont Orthopedic Center is set up and staffed to see those patients. So that allows patients more room in the ER for COVID and respiratory type injuries. So it's been a big win for us and a lot of collaboration amongst our physician staff, nursing, and all the ancillary staff within the organization.
That's incredibly reassuring, if I can speak on behalf of the community and as a member of from the outside looking in at you folks. Very, very good information, and very much appreciate what you're doing there.
Thank you.
In case you've just tuned in, I'm Tom Donahue with Brock Community Action. We're here today with important information from the Rutland Regional Medical Center. And we have with us the President and Chief Executive Officer, Claudio Fort, of the Rutland Regional Medical Center, and also Tom Rounds. Tom is an RN and Director of the Emergency Department at Rutland Regional, as well as Operations Section Chief for the Incident Command. We appreciate them taking the time today to bring you very important information about how they are functioning during this pandemic at the Rutland Regional Medical Center, and how they're caring for you as well as their staff during this time. As you know, it's a changing environment all the time, and they are stepping up to address all of the different challenges that they've faced, and they're here to talk to you about that today, to let you know exactly what they are doing, and it's very much appreciated. So with that, I wanted to go to another question, Tom, about that I hear a lot.
Sure.
About outside testing and how are you doing it, and because that's one thing that you see for all of us watching the nightly news,
Right.
And all over the country, of course, you see that. We know what's going on here too. What does that look like here, and how are we doing it?
Sure. We've taken a step to allow our providers in the community to order tests, and really the community partners, our folks at the community health center, our other physicians around the area, are able to put in test requests, and those are for people who are actually ill. If they're having COVID symptoms, shortness of breath, fevers, and they feel that they need to be tested, they fit that criteria, then the order's put in, and then we have a tent set up at our Allen Street entrance that's staffed by our nursing and laboratory staff, and people actually drive up under the tent, and they don't have to exit their car. We're collecting the specimen, and those specimens are being sent off to the Mayo Clinic. So we have support around the country too for our testing. Then we have another kind of a split flow where if somebody's an inpatient or a healthcare worker, they're in the hospital and they're sick and we need to get that tested, we're collecting those specimens in the hospital, and we've set up a shuttle where staff members from the hospital are running to Dartmouth Medical Center on a daily basis 3 times a day, so that we can turn those results around quicker, and that helps us to manage them within the hospital. So people have really stepped up and really worked to make sure that we could provide that testing for the physicians that felt that needed to be ordered.
That is absolutely phenomenal, and I really personally appreciate that, and I'm sure all our listeners do too. Thank you, Tom.
Yes, you're welcome.
Also, I know that there has been some visitor restrictions, and rightly so. The more that we pay attention to this, the more that we are vigilant ourselves, and some of this is out here in our hands to be socially distancing and so forth, and
Right.
Visitor restrictions fall along those lines too. It's how we're going to control this here in Vermont. Can you talk a little bit about those new restrictions at Rutland Regional Medical Center, and with us understanding that that's with full intent to help
Right.
us get through this, protect everybody?
Yes. Well, we've really looked at this from recommendations from the CDC, from our state partners, and also looked at cases around the country where they've had a surge and really had to address visitors. So we've used those recommendations, and at this moment, if you are suspected of COVID, the coronavirus, or if you are positive, then we are not allowing any visitor for that individual. We have also limited visitation for other types of patients. Say a child came in and was being seen, we ask that only one parent come with that child, because we really want to keep them safe and their family safe. And the same for folks who may be at end of life and they need support with them. So we do allow a visitor for that. So we're checking them at the doors every day and trying to really protect the community, the hospital, and our patients, and making good decisions about who should visit and who should not.
Thank you, Tom.
You're welcome.
And Claudio, and you can explain to me what PCP is, but or us, I should say, all of us listening and watching. If people do not have a PCP and are symptomatic, where would they go to get a referral, and would they just come to the emergency department?
Yeah. So PCP is kind of our acronym or shorthand for primary care provider.
I should have known that.
It's your doctor, it's your nurse practitioner, it's your physician assistant, your healthcare provider. And Our partner, if you don't have a primary care provider, you don't have a relationship with that, our partners in the community, especially the community health clinics, they have a great network of urgent care clinics throughout our communities with very convenient hours. They are accepting new patients. What they ask is that you call them first, 802-779-9169, 802-779-9169. Give them a call. They're your best option. If you're having mild symptoms or other routine health needs and you don't have a primary care provider, that's what they're there for. They will evaluate your symptoms and also determine if you are a candidate for testing. Testing is only available at this time, as Tom said, for people who are experiencing symptoms and only with a doctor's order. You can't just drive up to your emergency department or Rutland Regional's emergency department and get tested. Of course, I want to be clear though too, everything we've been doing here is to make sure the hospital is there for you when you need us. If you're having severe symptoms, such as difficulty breathing, chest pain or pressure, or if you otherwise feel like you are having an emergency medical condition, call 911 immediately or immediately go to the closest emergency room. We don't want you to delay your care if you feel you're having a medical emergency. The other thing you can do is you can also go to the Vermont Department of Health website, www.healthvermont.gov, www.healthvermont.gov. There is a tremendous amount of information for you on the number of cases in Vermont, clinical information on COVID-19, and I think they even just put up an online symptom checker through the National Center for Disease Control. So you can go there and get some additional information.
And I've been on that website and checking on it regularly, daily, and it is excellent. And thank you for sharing that, because it is a tremendous resource, and it does keep you sort of up to date so you can understand what's happening out here in Vermont, and other incredibly useful pieces of information, tips and things like that, things that you can definitely use are on that website. Exactly. So maybe you could reference it just one more time.
It's www.healthvermont, all one word, .gov.
Thank you very much. It is that good, and I appreciate you sharing that information. So Tom, we have other partners in the community.
Yes.
I know that you're working with EMS as well as our police and fire specifically on COVID-19. Can you talk about how Rutland Regional Medical Center is partnering with those great frontline workers throughout the community?
Yes. We took some key members from our incident command, the planning chief, our liaison, and myself, and we held a video meeting because we're trying to, social distancing is very important.
Excellent.
We met with the EOC for the city of Rutland and really talked to them about what our plans were and tried to prepare them for what we were doing as an organization. And the city did share with us that they were really focused on, providing water and sewer service, fire and police coverage for the city. And they're really working to slow the spread. That's their goal right now. And they are wonderful partners. We're very fortunate to have the city workers and our surrounding communities. We'll start to pull in emergency managers from the surrounding towns as this crisis develops. And I expect that in the coming days there'll be additional meetings and communication with them. The important thing to remember is that we're trying to limit what folks are doing in the community, really trying to protect themselves and each other, and certainly keeping that distance. And I think Claudio will have some additional information to share about that.
Yeah, and I do have just this one last question, Claudio, and it's really about that, because it's so important right now. What can the community do to stay safe?
Yeah, so I think it is more important than ever for us and for you to take care of yourselves. We are all under an incredible amount of stress. We're all looking at a lot of uncertainties as we deal with this crisis. And a lot of people have a lot of time at home now because they're not working, and Vermonters don't like to be sitting around cooped up inside the house. But it's really important that you take care of yourself. Be careful, especially at this time, about your use of alcohol and recreational drugs. That can easily slip into something you might do to relax to something you start getting dependent upon. Practice healthy habits. Eat right. Get your rest. Limit your intake of the news. I mean, you can't go home and just be obsessed about this because you have to have a little bit of a dose of that. And get some exercise, as Dr. Hildebrandt told us the other week. The other thing I want to say is I've heard reports that many people have gone out and purchased a firearm for the first time because they're scared and afraid and so forth. Please learn about, if that's the case, and practice responsible gun safety. Always treat the gun as if it's loaded, always point the barrel in a safe direction, and always store them securely when they're not in use, especially since we have so many of our kids home from school. And then the final thing I would say is what you can do to protect yourself and help your community and your neighbors is, as the governor, as the commissioner of the Department of Health, Dr. Levine, has told us, please stay home and only leave for getting essentials such as food and medicine. And when you're out, keep a safe distance of 6 feet between yourself and others. Many people have been going into the stores. We're not practicing this, and that's why the governor put in place some additional restrictions for stores to provide only essential items. It is important during this critical period. If we all stay together and follow those guidelines, you will give your community, your neighbors, your loved ones and families, all of us will have the best chance of surviving this and getting through this as safely as possible.
Absolutely critical, and appreciate you explaining that again because it's so important right now. We've been speaking today from the Rutland Regional Medical Center with Tom Rounds. Tom is the RN and Director of the Emergency Department at Rutland Regional Medical Center, as well as the Operations Section Chief for the Incident Command here in Rutland, and also, of course, the CEO and President of Rutland Regional Medical Center, Claudio Fort. This information is very important to us all, and we sincerely appreciate it. We are going to ask Claudio to give us some final comments, some words of wisdom, and we appreciate your words and the leadership that you're showing in this community, and we thank you for it.
Well, thanks, Tom. It's an honor. I work among we're very privileged, some of the most incredible, dedicated healthcare professionals anywhere in the country. And if you look at Tom, here's just one example. He's had 20 years of military experience and 20 years of operating emergency departments throughout the country, both a lot larger than Rutland Regional. A number of our physicians have had, and employees have had military experience that is coming into play, and we're seeing that play out as they're leading us through this emergency operation period. We have physicians who, on their time off, dedicate themselves to go on medical mission trips, and that experience has been invaluable in helping us plan and be prepared to take care of you during this less than optimal period on how we are delivering health care in this country. So I want to thank all my colleagues at RRMC and all our public safety and health and social service partners in our community, and all the service employees who are making sure that we have food and supplies. Incredible dedication and commitment. This is your finest hour. And I also want to say, as scary as this is, I'd ask people to kind of look at the bigger picture. You know, us as Americans, we're always known for going 100 miles an hour. There are some good things that you can find in between the chaos and the challenges we're facing. Take this opportunity to find the good and find the joy and comfort in the small things, which actually we're finding, and this is teaching us, are really the big things. Listen to your kids. And I think our children have a sense of optimism and resiliency that we can all learn from and depend on, and it's more important than ever. So I want to share with you in closing a couple of cards. We have one of our legendary nurses, her niece Olivia and her niece's 5th grade friends put together a series of cards for all of us to support us at Rutland Regional. And I'll share a couple with you. This one says, "Sunny days are ahead." And then this one says, "RRMC, beautiful days are ahead." We will celebrate together again. We will come together as a community again, and we will come out of this, like we've come out of all challenges like this, stronger and more resilient. Thank you very much.
Thank you, Claudio Fort. Thank you, Tom Rounds. And I'd also like to thank Gordon Trischillo for being here for the Rutland Herald and their attention to this important topic as well. I'm Tom Donahue with Brock Community Action. Thank you for tuning in. For Catamount Radio and PEGTV, we want to say again, be vigilant, stay apart, and be safe.